Hello, good morning, everyone, and welcome to the latest Idiaki webinar. Let's just go over some housekeeping rules for today. If you could kindly please turn off your camera and mute your microphone. If you wish to speak, please indicate so in the chat, and you can ask any question at any time. This webinar is being recorded, so if you don't want to be recorded, please do turn off your camera and you will not be recorded. And please do feel free to share after this webinar. The presentations will be shared after the event has finished, so please do not worry, and we'll also upload it to our YouTube channel. And questions and comments, use the Q&A chat box for any questions. They may be addressed live during the Q&A session, and unanswered questions will receive a follow-up email, which we always do, so do not hesitate. Now, beginning today, access to healthy indoor air often serves as a proxy for income inequality, with low-income groups disproportionately affected by poor air quality. Globally, communities with the lowest income, less than $1.90, tend to rely on low-cost fuels such as charcoal, kerosene, firewood for cooking and heating. The use of such fuels results in high levels of indoor air pollution, contributing to significant health risks. While this issue is more prominent in low-income countries, it's certainly not exclusive to them, as many reputable studies have highlighted. For instance, a study conducted in Fakulteta, Bulgaria, a large Roma settlement, reported widespread use of dirty coal for heating, leading to higher rates of pollution-related health issues, particularly respiratory problems among children. In this context, the following important questions arise. Why do lower income households or underserved communities often face worse indoor air quality? What sets of actions from economic, societal, political perspectives are necessary to address indoor air inequality? And how can the ideal cluster projects ensure that lower income communities have equal access to healthy indoor air in the push to improve indoor air quality? And how does recognizing healthy indoor air as a fundamental right influence policymaking and enforcement in Europe? That brings us to the latest installment in the EDIACI webinar series, co-organized with the Inquire Project, a breath of fair air, combating indoor air inequality across Europe and beyond. And with that, I'm excited to announce our stellar lineup today for this timely discussion. I'm proud and honored to introduce our outstanding panel for today's latest installment. Starting from left, we have Sinead O'Brien, co-founder of the Clean Air Advocacy Ireland, Jonathan Groth, senior researcher at COPSAC, Paolo Rostokowski, senior scientist at NILU, and Lina Davalina, senior researcher at the Department of Environmental Research, the Center for Physical Sciences and Technology in Vilnius, Lithuania. Just a quick run through of our agenda, and we'll begin hearing from our speakers. Introduction, obviously we've just done that. Then we'll go to marginalized communities and air quality experience of Clean Air Advocacy Ireland with CNED. Then we'll look at indoor air quality in non-profit housing, studying ethnically diverse and economically diverse populations with Jonathan. Then we'll look at exploring indoor air inequality across Europe, linking health and home variations, and from highways to health, tackling indoor air quality in schools near urban traffic with Lina. Then we'll move to our panel discussion, a breath of fair air, combating indoor air inequality across Europe and beyond. And then finally, you have your chance to speak, but you'll always have your chance to speak because you can write any questions in chat at any time, and then we'll start addressing them at that point in time, and then we'll have some concluding remarks from our side. With that, I'm very honored to give the floor to Sinead. Sinead, the floor is yours. Please go ahead. Oh, Sinead, your microphone,
Sorry. Thanks, Alex. I'm just laughing over here because your description of the poor air quality and the kind of low-cost fuels that you describe is just basically the whole west of Ireland at the moment, because since we've had that storm, everyone's burning solid fuels, using gas, and celebrating these things, we're really going backwards, which is very disappointing. To answer the question that you put to me, I guess it's I'll start with giving the kind of Irish context on indoor air quality and what are the major contributors to that and why do we care. So I suppose that we formed because we became aware of the airborne nature of certain pathogens as a result of COVID. So really, thanks to the aerosol scientists and engineers who educated us, like just members of the public, we kind of galvanized and got together to sort of promote the technologies that were shared with us, such as HEPA filters and ventilation, which we'd never really heard of before. And so I suppose because a lot of our members would be immunocompromised or have immunocompromised children, they have concerns about sending their children to school and into healthcare where the air is not being treated, for airborne pathogens, but also as we are now more increasingly aware of other pollutants that are in the environment. So I suppose mold is a big one in Ireland because we're such a damp environment, and because we have quite old, poorly ventilated buildings. I suppose that issue is just, I suppose, exacerbating because of the I suppose warming from climate change and the increased humidity. So this is a major problem that needs to be addressed, that I suppose cleaning the air would help mitigate against as well. I just mentioned the burning of solid fuels, wood, coal, turf. These are kind of now considered rights of people, which is, as I say, it's going backwards, it's regressive. With this power outage that we've experienced, like I'm on day 6 or 7 now without power. Yeah, people are now kind of changing their plans. If they had plans to retrofit their houses to make them more green, they're saying, no, actually, we need to keep our wood burning stove and our gas burners for security. So that this is, it's particular to the Irish context because our infrastructure is so backwards, I suppose. We have a lot of overhead cables that we've now seen do not hold up in a storm. Traffic fumes, like, yes, we do have urban areas around Ireland, and those would be major contributors to the poor indoor air quality in those areas. I suppose we're not like London or any kind of major city like that, but we do have quite a car-centric transport infrastructure. So even though we have, a small population and smaller urban centres, we are committed to the car still, because we just don't have good public transport networks. And so that is contributing to poor air quality. The cultural aversion to letting the heat out is a major one. People, it's funny, like I remember when I was pregnant and going into hospital for checkups, and I'd open the windows because it would be such a crowded building, and everyone, you'd have people coughing, and it just felt like it'd be good to let some fresh air in. And immediately someone would come along and shut the window behind me. So it's a cultural thing. I think in mainland Europe there's more of a culture of opening the windows every day to let fresh air in. That certainly doesn't exist in Ireland, and it doesn't help with the mold situation either, actually, to be honest. So yeah, all of these factors are bad for our health and general well-being, which is why I suppose we put Clean Air Advocacy Ireland together. How does poor indoor air quality impact low-income and other marginalised communities? So, as I mentioned, like the poor indoor air quality, it doesn't really discriminate between rich and poor. Like at the moment, anyone with a gas hob and a wood-burning stove is considered to be in a privileged position because, nobody has, a lot of people still don't have power. But of course, like the burden of poor indoor air quality is experienced in a greater degree by low-income households. So yeah, this is, I suppose, contributed by the rising costs of energy. So people are turning to again those cheaper fuels to heat their houses and to stay warm. The housing crisis, I know that it's being experienced internationally, but it's certainly very acute in Ireland. it's leading to overcrowded living conditions. So just a lot more people living in a household, multi-generational households with people moving back in with their parents, and they may have grandchildren as well. So that doesn't help when it comes to, I suppose, the airborne virus situation, where you have elderly relatives living with young children who might be going to creche and bringing back pathogens. So those are all issues. And then I suppose, yeah, the old building stock, poorly ventilated, moldy buildings. And I have to say, like, while this is something that affects marginalized, lower income households, I know people who are paying over €2,000 a month who have mushrooms growing out of the walls. So it's certainly it's across the board. Like that's kind of how bad the situation is now, that it's affecting all income levels. I suppose we in Clean Air Advocacy Ireland take a broad view on who's marginalised. So as I said, like we were mobilised because of the pandemic, and I suppose our learnings on cleaning the air and clean air technologies to reduce airborne pathogens. And so we would kind of see immunocompromised people as being the most marginalized in our current situation, because the environment that we're expected to live in now, it doesn't really cater for people who would get very ill if they contracted a virus like COVID or any other virus, which are increasing. So yeah, infants, children, immunocompromised people, vulnerable patients, homeless people, refugees and asylum seekers, prisoners, and people who work in the institutions along this corridor, people are who we consider to be marginalized in the context of clean air and so I suppose indoor air quality. So yeah, I think you'd just gone forward there to show some of the graphs of just rising cases of other airborne and droplet spread illnesses since the pandemic. So it's just like, for us, it's clear that if we were to improve our indoor air quality and the technologies that help clean the air, we'd also be helping to reduce the spread of other common illnesses now, which really shouldn't be spreading in this day and age, but unfortunately are. And I suppose, how can indoor air quality be reframed as a fundamental right rather than a privilege, particularly within the European context? So yeah, this is an interesting question, because I suppose within the Irish context that I've just kind of briefly described, clean indoor air and indoor air quality isn't really recognized as a privilege still. I think it would be a lot easier to sort of make demands for it being a fundamental right if we first recognized it as being something that is desirable. But one thing that we're seeing is that, like, corporate and state bodies that have introduced clean air standards in their buildings for their employees, they don't appear to be advertising that they've done this. Like, so there's no public awareness that actually there are institutions and buildings that are cleaning their air and have very good air quality. And yeah, I think like universities and sort of multinational companies are doing this, because in the next slide, sorry, I've mentioned that in 2023 the HSA, which the Health and Safety Authority, have published a code of practice for indoor air quality. And now this is actually backed up by legislation, but it's quite weak in that it's not very clear on how it's enforced. So of course, like, institutions that have more money, I suppose, to spend on the infrastructure of their buildings, they've gone forward and improved the air quality, which is fantastic. But it's just not it's not being made well known. And I suppose those other buildings like schools and healthcare settings aren't being upgraded. And that's a major problem, because, we're sending children into classrooms, overcrowded classrooms, I should add, where the indoor air quality is poor, which is not just, that also has negative impacts on concentration levels for learning. So yeah, we definitely have a ways to go. Like, it's a step in the right direction, I suppose, that the state has introduced a code of practice, and they're clearly aware of the need for indoor air, clean indoor air quality. But we have a ways to go in terms of enforceability, and but I suppose it's something for us to build on in terms of demanding clean air quality, particularly indoors, as a fundamental right. So I hope I didn't go on too long, but I think that's me wrapped up anyway.
Firstly, we want to obviously say thank you so much for making the time today. As you know, in Western Ireland, they had a very bad storm a few weeks ago. I think the point you made a few days ago, sorry, one of the points that you made that was really strong is this point that there's this regression back. And I think it's really interesting because, I mean, it's extreme weather to do with climate change as well, right? I mean, I don't want to add, obviously I'm not a climate scientist, but extreme weather has been associated with climate change. So it's
Yeah.
funny that there's this regression going back, and then so it's almost might make the situation even worse as well. And I found it very powerful, the marginalized communities that you mentioned. I didn't think about prisoners, for example. I think that's and refugees, for example, who live in often substandard conditions. So I think those are really powerful. We'll come back to you now. So thank you, Sinead. And now we're going to head to Jonathan. Jonathan, the floor is yours. Please go ahead.
Yeah, so thanks for inviting me, Alex. And this is actually a nice extension on the topics of mold and infections. I'm just getting started on a study, and this picture in the background is actually of the area. The first high rises actually in Denmark that were built in the 50s. So now they're getting a little bit old. But here you can see right in the middle of this picture, some of them are fully remodeled. And on the left-hand side, you've got some of the buildings that are not yet remodeled and kind of hidden a little bit in the background behind scaffolding and plastic are some buildings that are in the process of being remodeled. And all of this has led me to think of this quasi-experimental design, where I'm interested in finding out whether the rates of respiratory tract infections and other respiratory symptoms among the residents in the remodeled apartments are different to those in the not yet remodeled. And we'll look at that with two different quasi-experimental approaches, one within the same season and then one within the same person over time. And we'd like to get some objective measures on mold, and we also like to get some objective measures of respiratory tract infections. So we will use rapid antigen testing and electrostatic dust collectors for the molds. And this is building a little bit on some previous work where the question is kind of what is going on when people have reported associations between mold and respiratory tract infections, because I think it's generally accepted that mold exposure might lead to sensitization, and that the allergies part of molds is quite, I think, definitive. And in terms of asthma, that's also fairly well accepted. But some of the effect estimates we see for respiratory tract infections are at least of the same strength. And that's kind of interesting to find out what is going on. And in this scenario, I'd like to look at remodeling, so mold remediation, and specifically try to find out if some levels of mold exposure, the differences in the mold exposure might explain differences in the susceptibility to respiratory tract infections, likely more severe respiratory tract infections rather than incident cases at all. But we would like to try to figure this mess out a bit so we can say something more about who might be affected the most by mold, and maybe everybody is affected to some degree, even if you don't have allergies or asthma. So next slide, please. But obviously, every every study where you're going out to try to collect some primary data comes with some challenges, and this is a neighborhood that's quite diverse, and it's a multi-ethnic group with a lot of different backgrounds, different economic resources as well. But they're all living in a nonprofit housing area. And I think one of the main challenges might be participation, and from previous work, trust and interest in the actual topic of the study are very important to be able to achieve a good participation. So we would like to address the potential language and cultural barriers by translating materials and meeting people in the language that they're most comfortable with. And we would also like to acknowledge that that no area is a monolith, and that there are diverse needs and suggestions that might come up, and try to address those as well as we can. Next slide. So it may come with unique challenges, or I probably should say it will come with unique challenges, but I think it's still worth including understudied populations in these hard-to-study settings, also in quantitative research, because I think qualitative researchers are really excellent at this. They know how to think about themselves in a context as a researcher in a setting, and I think we might learn a bit from qualitative researchers. And with quantitative research, we want to make sure that we have enough power to actually be able to detect any differences. And this might steer some people away from doing a study like this, but I think we should more be just inspired to try to do this well. And finally, I'm certainly not doing this alone, and I'm surrounded by very smart people who have more experience than I do in this area, or in different areas of infectious diseases, housing, mixed methods and stuff. And I can't mention every single collaborator here, but Gekadund is a professor of social medicine who I'll be collaborating very closely with, and Klaus Beneduk as well, to try to make sure that this data collection works as well as we possibly can make it. And I'm also very thankful to be able to have gotten funding for this from Redane and Fund and Headsfund.
Jonathan, thank you very much for that in-depth look at your study. We're excited to see the results later on. I think this will coming out next year, so we'll try to share those at some point. And it was very interesting to see your graph. It looks very complicated, the work that you're working on there with all the different components. I think that was a really interesting picture to look at there, and it really goes to show you the complexity of the study as well. With that, we'll now move ahead, and we'll see Jonathan in just a little bit of time. We have some questions for him, but with that, we're moving to Pavel Rostovsky from Nilu Institute. Please, Pavel, the floor is yours.
Thanks a lot. So, yeah, and thanks for the introduction. I'm a senior scientist at NILU, and I'm also a scientific deputy of Inquire project. And our Inquire project, we are working on identification of chemical and biological determinants, their sources and strategies to overall promote healthier homes in Europe. And yeah, here I will just highlight that our mission is to guide and foster innovations in policy and regulation, and work with industry towards sustainable approaches, and and update policies and regulations. Will generate a lot of data and science-based evidence that are available, and they are much beyond the indoor air quality guidelines. But one of the things we are discussing here, inequality of indoor air quality, there are many factors that are influencing it, and one of them, or one of the few, are climate and building design. I mean, you obviously have different buildings in Northern Europe and Southern and Eastern, but because of the climates, and due to that, we are dealing with different risks. And in Inquire project, we are doing sampling campaign and investigating 8 different countries from these different areas. So once we have our data available, it would be a lot of results to share. I hope interesting, not too scary. Because when we talk about the area inequality and key drivers that are important, of course, the other one of the key drivers is economy. In welfare households, when the education is often higher and the resources, there are a lot of more resources, we could expect better ventilation, air purification, and this is more regulated construction. But in the same time, these welfare households, they are doing renovation more frequently. Because they can afford it, and then they do it frequently, and then they cause exposure. They can cause exposure to different pollutants, maybe not necessarily to the traditional ones, but when you introduce new products, then you may face issues with the emerging indoor chemical hazards. In a low-income housing, of course, you have issues related to the design. You have poor insulation, lack of HVAC systems. The buildings are quite often old and a little bit damaged. And and then you could expect a higher exposure to pollutants from, well, these cheaper heating methods, coal and wood. And that were mentioned also when you lose the electricity and you cannot use and you cannot use the more modern and more green means of heating of the house, but also lower quality products that are being in this housing that are being introduced, and they are maybe not so well tested. I will not mention here any well-known Chinese shopping platforms that are introducing a lot of non-tested stuff. But in addition, then again, the energy topic was coming out, was already introduced earlier today. This was an accident, but still, that was mentioned by Sinead, but still a large percentage of Europeans cannot afford proper heating. It leads to poor ventilation, damp conditions, mold growth. But in the same time, it's not only that these cheap heating methods are coal and wood, because in many cases, in many areas, we are aware that they were using even cheaper heating methods, burning up the waste. And of course, another topic is of emerging concern is unmonitored indoor pollutants. Every day, new building materials are introduced. We are getting more and more electronic devices in-house and personal care products, and many of them are releasing unregulated and the chemicals that are not tested. So, and there are many health impacts that are already known: respiratory issues, cognitive and mental health effects, and especially children and elderly are at higher risk. They are more exposed, and in Inquire we focus on the housing with children. And I must say, this morning when it was, actually just before this seminar, I found an interesting paper that was issued by the medicine doctors, that it's a call to save the children, mainly because of the increasing chemical production and not sufficient studying of the effects. So it's very much well in line what we are doing and what we want to achieve. As I mentioned, emerging indoor pollutants, it might be a monitoring gap, because they're in indoor. There is a lot more than beyond traditional IAQ pollutants, a lot more than PM 2.5 and CO2 and radon and mold. As you may see on the right-hand side, this is a report from 2020 of the EEA with over 100,000 chemicals on the market. There is only, and of course now these numbers are surely outdated and there is a lot more. There is only 500 chemicals that were extensively characterized for their hazard and exposure. But there is a big unknown, so we don't know what are we using, we don't know what are we breathing, and so I wanted to highlight that it's an issue in monitoring, and this is also caused a little bit by lack of standardized IAQ regulation across Europe. And quite slow policy adaptation to these emerging pollutants that many of these health impacts remain understudied. I mean, only very lately, endocrine disruptors were recognized and were brought up to the discussions to include them in the REACH regulation. And this is something also when we discuss with the colleague, how we define with VOCs. When we talk about VOCs, I always ask, how many are you talking about? Some people say it's 90. When we started to work with it with our analytical methods in Inquire, we are able to identify well over 200 compounds in one sample, and the number is growing. And I will not mention how many of the peaks we are seeing that are not yet identified. So there is definitely a gap here, something to do. Yeah, but in this case, at this place, I would like to conclude. So I hope we all agree that unfortunately, indoor air quality varies across Europe, not only due to economics, but also due to the climate. But low-income populations, they face much higher indoor air quality risks, but with the health consequences are being severe. More work and more research is needed, and I agree with the medicine doctors that were publishing it and in addition, the strict and fast adaptable policies should be introduced, and better building regulations, and more investment in the ventilation and in air quality monitoring. And I must say, awareness campaigns for healthier indoor environments. We need to educate on sources and prevention, but also show up simple solutions, because in many cases to improve the INQ in many environments, yeah, it's just to educate people that they can open the window. And I must say, I have experience even in Norway that some people were not aware that simple opening the window would improve their indoor air quality. And at this stage, thank you very much for your attention. If you are interested, don't hesitate to contact us either on my personal email or on the Common Inquire. And we are interested in gaining more stakeholders that would be interested to hear more and maybe contribute with the interest to Inquire projects. So you can reach me on the email as well. Thanks a lot.
Thank you, Pavel. That was a surgical dissection of the socioeconomic impacts on housing, and indoor air quality. And I really found it very important that you highlighted something else there as well, with the relationship is not so neat, right? Even in certain cases, maybe having a high income, for example, you could be more exposed because of renovations. I thought that was a very interesting point. Surgical dissection. There, we'll be hearing more from you. So if you have any questions for Pavel, please do ask in the chat. You'll have an opportunity to hear from him. And now we're turning to a dear friend and colleague, Lina Devalina, to look now at highways, from health to highways. Here, the floor is yours, Lina. Your microphone, Lina, your microphone. There.
Yeah, thank you, Alex, for introduction. So according to European Environmental Agency, schools and other educational institutions are often located near busy roads. There is not much statistic on this, but for example, in Netherlands, roughly 3% of the schools are located less than 300 meters from busy roads. Next slide, please. Yeah, so here you see our school we chosen for Vilnius campaign. It is located in Vilnius center, 150 meters from a major 8-lane motorway, and is surrounded also from all sides by 2-lane roads. Exposure to air pollution and social vulnerability, these are two areas overlap when a person is limited in their ability to relocate. So for example, in this case, if somebody is not satisfied with air pollution in this school or in any public school, it is hardly possible to change it, because actually all schools in the bigger city in Lithuania are overcrowded. Talking about exposure related to lifestyle and behavior, so children like to be outside during break time, and therefore the quality of outdoor air is also important. Next slide, please. Yes, so housing and quality is the next big topic. And most important point here is the ventilation of the building. Our school was built in 1963 and it has a natural ventilation. Only new schools in Vilnius have a mechanical ventilation back systems. So this is an old building and it was renovated and the wooden windows were replaced by plastic windows, the openings of which are limited to half or in some classes even to a third of the former area, as you can see here in the pictures on the right side. So here I would like to also emphasize that the type and quality of housing is hard to change. It is hard and costly. And it's only part of the problem. So then looking for ways to improve indoor air quality, everyday management decisions related to indoor air quality should be considered first. In other words, it should be examined how effectively the available possibilities of natural ventilation are utilized. But the balance between indoor and outdoor pollution sources is a challenge when the outdoor pollution is high. So next slide, please. So here you see a very simplified scheme of our campaign. So here's a form of a school, and starting from an entrance, we had put sensor near the entrance, and then at the end of the corridor, and in two classes facing different sides of the school, one to the highway and one to inner yard. There is also parking. So next slide, please. And so I would like to illustrate the dynamics of indoor air pollution at school by comparing the influences of indoor and outdoor air pollution sources on a randomly selected day. I took PM2.5, which is the external traffic related source, and CO2, which is the internal source, so as it reacts to presence of people in the room. So here you can see that, so we can see PM concentrations during school hours, and both outdoor sensors, they had maximum in the morning, and actually then during the day, concentrations decreased with similar rate but different phase. And outdoor CO2, of course, was stable as expected. So next slide, please. The concentrations measured in a classroom, this red line here, in the morning, it was like only 15% of outdoor concentration in case of PM particular matter to 2.5 diameter. So because the ventilation was really limited during the night, only ventilation ducts were open. And as you see during the day, when windows were open, so fluctuations were also not very high because the concentration outdoor was falling. So, but in CO2 case, we see a completely different movement. So CO2 reacted sharply to the presence of children, and it was like adding with every next lesson, and also during the time breaks, the concentration during the class was not falling. It is due to this limited ventilation. So only in the afternoon, when the class was empty, the concentration started to decrease slowly, but very slowly, as until the end of the school hours. So then next slide, please. So here, the rest of the sensors is added here. So the blue line refers to the class which with windows facing to schoolyard, and the green lines are in the corridors. In contrary to expectations, the initial PM concentration in a classroom facing the schoolyard in the morning was twice as high as in a class facing the motorway. So like 30%, it made 30% of the outdoor concentration. So it's because during the night, also additional ventilation option was on, let's say. So smaller upper windows were opened. So we have a different balance concentration here in the indoor. And but it's better for ventilation. It's seen in the CO2 concentration was not so high in this classroom, but anyway, it was a bit higher than recommended. So in general, due to limited ventilation in the school, indoor concentrations of CO2 and PM particles do not reach outdoor levels during school hours, which is favorable outcome in case of particulate matter, but it's opposite in case of CO2. And actually, we see large difference in CO2 concentration levels between classrooms because mainly by differences caused mainly by differences in ventilation-related choices. So next slide, please. I come to my conclusions. My conclusions in the form of keywords, and starting from the bottom. So usually in buildings with natural ventilation, indoor air quality management is limited to maintaining thermal comfort, also keeping in mind the cost of energy. So CO2 is odorless. We also cannot see PM. So even then it reaches limit values set by World Health Organization or even set by the EU, which is limit value set by is higher. So therefore, if so measurements of heat pollutants and other components that determine the quality of indoor and outdoor air should become routine measurements on site, actually. In other words, monitoring that provides data for information and knowledge-based decision is needed here. And schools should have priority, of course, when this monitoring is organized, let's say, at national level. It may sound complicated, so this measurement and decision-making may sound complicated, but it shouldn't be if the indoor air quality regulation is going to be applied in a large scale to ensure a healthy environment for all. And this is the area where actually, besides technical solutions on site, the numerical simulations of air quality in the city and real-time data analysis could be employed, along with so popular now, artificial intelligence for data analysis and also artificial intelligence assistance for indoor air quality decision-making. So that's it for me. Thank you for your attention.
Thank you, Lena, for that in-depth insight into our Vilnius pilot. Very interesting work, very interesting preliminary results that we have. And thank you very much for sharing those. We'll be coming back to Lena now in just a little bit. First, we're going to test. So now we head to the panel discussion. I ask speakers to please be a little bit quick with your answers now, so we can have a chance for the audience to speak. Please, all speakers, do turn on your camera and let us have this conversation now. Okay, Sinead, I know you've addressed this already in your presentation, but maybe if you had any more points that you'd like to make that you think are really critical on this point. What are the primary dynamics concerning the intersection between poor indoor air quality and marginalized communities, which is the issue that you tackled in your presentation? But I'm wondering if you have anything else that you would like to stress as the biggest message.
Yeah, I think again, with the aftermath of this storm that's impacted us, it's really highlighted, I suppose, disparity between those who could afford to upgrade their homes with better insulation and heat pumps and, those sort of solar panels and battery packs versus those that just simply can't afford outright the money to sort of upgrade their homes to become more resilient to these kind of power outages. And then also renters who have no control over the homes that they live in. So that is a big issue, because as I mentioned in the presentation, like we do have a big housing crisis. And so there's going to be a lot more required of landlords, whether they're private or public landlords, to upgrade homes to improve the air quality, because mold, as mentioned by many speakers here, is a big problem also.
Dina, thank you. I think it's a point Pavel made as well very strongly. Is this, not having the affordability in order to make improvements in the household and then relying back because of maybe insecurity in terms of electricity usage. So I think very important point. Jonathan, coming to you, can communities now, seeing this kind of issue, can communities take action into their own hands? Can these poorer or more marginalized communities take action into their own hands in order to improve indoor air quality despite these structural inequalities?
I think it's a little bit of a non-answer maybe, but it very much depends on the situation and what indoor air quality issue there might be. But I think there are certainly things that, for example, residents can do to improve the indoor air quality by like opening windows, and there are certain cooking practices and stuff. But I don't think you can expect that to be to stand on its own. And especially with housing, then it is one of the factors that is very influenced by resources. And so I think certainly in some situations communities can do more, and in others sometimes they really need support.
Maybe self-empowerment is not a panacea, but then there needs to be an addressing of the structural inequalities there. So even though it was a non-answer, it was a comprehensive one at that. Moving to Pavel, what are the primary factors, such as location, ventilation, heating systems, building materials, furniture, and other indoor products that significantly influence indoor air quality, and how are these factors linked to income disparities? You've already kind of dissected this, but please provide a little bit more.
Yeah, you've heard most of it, but I think, these factors are often splitted to or grouped together depending on the location, because in many cases it's you're not dependent on the heating systems. I think a common thing here are indoor products, because regardless your building and location, you buy stuff, and that can affect your that can affect your indoor air quality. But also, yeah, when it comes to income disparities, yeah, that they add up. I mean, when you are limited, when your economy is limited, well, everything is worse. You live in worse location. You have typically worse ventilation and heating system. So I would not separate it. It's all together. But in the same time, when it comes to income disparities, your indoor air quality, then it's quite often affected by your poor ambient air quality. Then it actually adds up another factor that I was not mentioning in my presentation.
I think that's a very important point, and something kind of Lena had touched upon on hers. And I think one of the things you're really highlighting here, and all of the speakers, is we need a multifaceted approach to addressing indoor air inequality. So I think that's a very strong argument there. Lena, turning to you now, how can these campaigns, that is the Vilnius campaign, be better designed to more effectively explore and address economic disparities that often coincide with poorer indoor air quality?
Thank you for the question. So when it comes to exploring economic disparities, it is convenient to compare the countryside of cities or city center with densely populated suburbs. But if you include the air quality in this comparison, so there is a good chance that the results will show an inverse relationship. So to avoid this confusion, I would say that the locations for venues you are researching they should be as close together as possible, and but should represent economic differences of people living there. So, for example, spaces in different neighborhoods with different income levels, different distances from major roads, and other local sources maybe. So it is the main point. And of course, what is very also important, that the level of knowledge and commitment of the inhabitants also should be analyzed in solving this. Commitment in analyzing this indoor air quality problem should be assessed too. Thank you.
Thank you, Lena. It's very interesting to think about it in the reverse there. I think it's a very interesting point. That's something maybe we can look to do in future indoor air quality projects. Turning back to Sinead, you did answer this, but maybe a little bit more here. Why is it important? How can we reframe it, and why is it important to reframe it as a fundamental right? Maybe I'm adding why as well.
To add to what I said before, I suppose, I mean, we all deserve the right to breathe and not, get sick. I mean, it's pretty fundamental to human survival. I would say we need to liken it to having a right to clean water. It is that fundamental. So whether, we're eradicating, disease or pollutants, like it all needs to be clean so that it improves just general public health for the most vulnerable in society as well. And how reframed, sorry, how is the big question. I suppose education, making people aware of how important it is. I think that's really, for us in Clean Air Advocacy Ireland, when we try to advocate and we have parents going to schools asking for HEPA filters to be introduced into classrooms, and they get a lot of pushback because they're told, oh, well, that's unnecessary, or, there's no regulation that tells us we have to do this. And so I think there's just a huge gap in awareness in terms of how important it is to have clean air in a learning environment in particular, but also in healthcare environments as well, to reduce the spread of infection and just to help people recover from whatever ails them.
I think that was a really important point on the water as well. In fact, we had Malcolm Bama from the co-founder of the Green Party of Switzerland who said something very similar on those lines in another webinar. And in fact, it had a massive effect, making clean water a right in Europe, and had a massive effect on health. So it's a very strong point, just to back that one up. Now, moving to Jonathan, how can individuals and communities be supported by policymakers to bridge gaps in indoor air quality? If you could be short and sweet, much appreciated, so we get to some questions.
Yeah, I think, I guess mostly it's a matter of policymakers making sure that they're interested in which issues there might be that are specific to certain groups. So that would, I guess, be a good starting point to find out which issues might need policy for individuals and communities to be supported.
There's this needing to tailor the solutions, to tailor the policies to address specific people. Pavel, short and sweet as well, please. What strategies can be implemented to effectively improve indoor air quality in an equitable manner, ensuring meaningful progress across all sectors of European society?
I would begin from educational actions on all levels, starting from inhabitants, but also from the people that are responsible for urban planning. Because in some cases they are not aware that a simple change, I don't know, using nature-based solutions could heavily affect and improve indoor air quality. So here, short and swift, education, and then the other things will come after.
Couldn't have been more beautifully and concisely said. To Lena here, again, last question from our panel. In what ways could insights from the Vilnius pilot help inform strategies to ensure equal access to healthy indoor air?
Okay, so thank you. So the results of our research are still being processed. However, this preliminary analysis indicates that even minor variations in ventilation management in naturally ventilated buildings, which are common here, it can significantly impact air quality. But of course, achieving a balance between thermal comfort, indoor-outdoor air pollution can be a challenge. And the first step to ensure access to healthy indoor air for everybody, the requirement to monitor indoor air quality and to meet certain standards could be implemented for public indoor spaces in the future. I think that would be the most important step. Next step to clean air.
Powerful last words for the last question of the panel. I agree. We need more monitoring. We need more data. Okay, you've already asked a lot of questions, but please, now it's your time to have your say. We'll answer all the questions that we can in the chat. We already have a list here. We're going to start with Enid. We're going to take an extra 5 minutes as we started 5 minutes late today. Enid, could you, there's a thank you for your presentation. My question is, what strategies are Clean Air Advocacy Ireland employing to raise awareness and get a step closer into influencing policy? Can you share some examples?
Yeah, that's an excellent question, and one we're grappling with ourselves because we're a fairly new organization. We just formed last September. And I suppose we were kind of hampered by the fact that our government was coming to an end. And so we had a general election in November, and we've only really got a government together last week. So now we're really starting to get organized, to contact our new ministers for health and for children and education. But also, I think it's important that we work with members of the opposition in terms of just raising kind of awareness across the board that this is something that's necessary. And then on top of that, because we're aware that politicians only listen when there's public pressure to do something. So really, like as Pavel said, education is the key. We need to just inform the public as best we can. And so social media is a great avenue for us, as again, having no budget, we're a small organization of volunteers. We need to get the message out. And so it's great to see, groups like this having webinars, discussing this topic. And I have to say, like, the education piece has been done to a degree by scientists like yourselves, who've reached out to the likes of us, who are just ordinary members of the public, who are concerned for our children's health and for public health. So yeah, hopefully things start to move a bit faster, because I know we're all getting impatient and we all want clean indoor air for our families.
I think that's a very powerful statement there as well. And it's very interesting to hear the work that you're doing and how you're working with all the political spectrum. And a very powerful statement there. Okay, we'll go to Jonathan, and actually to Pavel first. And this came from Sotiris, who just said he'd like to introduce you to the Global Air Standards Initiative, and where we want to raise awareness about establishing common standards for indoor environments. Your input, I think, is very important. Have you heard, maybe that's the question for you, have you heard of Go AQS?
I've heard that this initiative was being created, but then I did not follow it. And then when I wanted to check, I found out that you guys have issue with your website. So update your security certificate so I can learn more and connect.
So
but definitely our input. Well, we are happy to give input and collaborate with all of you.
We will organize putting you in contact with Sotiris. It's very interesting work that they're doing there at Go AQS, and in fact, he's been very helpful with the project as well. Jonathan, thank you for your presentation. I think you shared the website. Okay, and now maybe just throwing a question out to everyone. Do you know any successful urban planning model city area where IAQ was in the focus? So maybe that's a question to every single person. Do you know of any urban planning model city where IAQ was the central focus?
Sorry, Alex, I didn't quite catch it. Was that to me or to?
That's to every single. That's to
everyone.
every single person. So maybe we can start with you, Jonathan, and then we can go to Pavel and Felina.
So I'm not 100% sure, but I think Board in Bradford has been doing a study within Board in Bradford where there is some focus on the indoor air quality, but I'm not sure what aspect of urban planning was involved in that. But other than that, I'm sure there are good examples, but I'm just not up to date.
And Pavel? Would you know?
Yeah, to some extent, there were some attempts in Oslo, but they were not called an IAQ, but this was more about starting from improving of the ambient air quality that would influence. So it was kind of indirectly with nature-based solutions and obviously with modern buildings and materials. So to some extent, there are some attempts in Norway.
And Lina, do you know of anything? I guess maybe our study in Vilnius.
So I think that indoor air quality is subject for research for a long time already, but maybe the implementation into politics is struggling.
I think maybe COVID has reignited it. I hope that now that maybe other issues have surged a little bit ahead of the issue of COVID, that it doesn't get thrown into the background, and it's something that needs to be in the mainstream of air quality as a whole and environmental health as a whole, I would say. I see one hand raised. I see Adnan, who's one of our expert advisory board members. Please do come in. He's a renowned...
Hi, Alex. Hi, everybody. Just to mention, there's a fantastic study going on in West London by Frank Kelly's group, which is West London Healthy Home and Environment Study, which focuses on indoor air quality among deprived communities in West London.
So that's another one to add there. Thank you, Adnan, for adding that important contribution there.
I'll send you the details, Alex.
And then we'll send this all after the webinar today. I'm looking at the time. I'm going to close the conversation. Actually, Jonathan, please come in.
Oh, sorry, it just slipped my mind. I have a very close collaborator who has been working on that specific topic. It's called the Home Health Study. So I thought I should just mention that.
Thank you very much as well. So please do send this, Adnan, do send this, Jonathan, anything that you have. We're going to email all of the participants today with the slides. We apologize. I hear that some of you had some issues with the slides today. So this has all been recorded. So if you want to hear the conversation again, you can always, and if there's a particular point that you were very interested in, you can always go back and you'll have all of the slides and all of the websites and everything possible to do with all of these different projects and initiatives that you've heard today. And with that, we're excited to announce our next webinar in our webinar series, co-organized with the Synergy Project, another member of the Ideal Cluster. This will take place on February 21st at 10:30 CET. That will look at some of the best national level examples of legislative acts to combat indoor air pollutants and promote healthier indoor environments. For more information and to register, please use the link that I am now copying into the chat. I should have been a little bit more efficient here. And okay, if you're interested to join, please do come. With that, we encourage you to become a part of our vibrant community by joining the Inquire Project community. Here is the link to their website, the Inequality Project community, which you will see now in a little bit. So just wait 1 second for that. And then the broader Ideal Cluster community, along with various other initiatives for seamless updates, information, and more. And here's the Ideal Cluster social channels. I'll wait for just 10 seconds here. So I hope you have your phones out and you are scanning the QR codes. Okay, now I will wait for another 5 seconds. You get lots of QR codes to scan, lots of communities to join. Okay, I'm leaving that for 5 seconds. For the webinars, we will post them on the YouTube. So if you're interested in seeing some of our other webinars, please do go to our YouTube channel. And finally, we extend our heartfelt thanks to our panelists for their invaluable perspectives and to you, our audience, for engaging discussions that brought this event to life. With that, we conclude today's session. Until next time, stay connected and informed, and wishing you all excellent air quality, both outdoors and indoors. Thank you and goodbye. Thank you, everyone.